Hey, it's Jordan. Delighted to be joined by Mary Grant. She is the Public Water for All Director for Food and Water Watch, which does great, underappreciated work. And most of the time, I am talking and reporting on really bad things pertaining to the EPA and other regulatory agencies. I think this is pretty good news, actually, and I wanted to dig into it. So, came out recently that the EPA is finally setting regulations on PFAS, which are short for forever chemicals. For people that don't know, that movie with Mark Ruffalo, Dark Waters, where he was depicting the attorney that fought DuPont after DuPont poisoned the Ohio River Valley with these forever chemicals for decades. These forever chemicals are very dangerous. They're pretty much in water systems all over the country. They're very hard to break down, and they cause cancers, reproductive issues, and a whole host of other things. Let me just briefly read what the EPA is doing before I get your reaction. EPA says forever chemicals must be removed from tap water. For the first time, the federal government is requiring municipal water systems to remove 6 synthetic chemicals linked to cancer and other health problems that are present in the tap water of hundreds of millions of Americans. The extraordinary move from the EPA mandates that water providers reduce parafluoroalkyl and perfluoroalkyl substances known collectively as PFAS to near zero levels. So what is your initial reaction? Because it sounds good, but obviously the EPA says a lot of things and it doesn't always follow through. How are they going to regulate this? And obviously that would be costly for companies to try and zero out their PFAS, byproducts in their manufacturing.
Yeah, well, my first response was finally. This is way long overdue that EPA is finally taking real concrete steps to address the crisis of toxic PFAS in our water. Community organizations have been fighting PFAS and fighting for EPA to take action for decades. And just for to back up, PFAS have been used in a variety of consumer products since the 1940s. And then these big chemical companies that produced PFAS have long known about their toxicity, and they hid that data. And it was because of the lawyers, the community groups that put pressure on EPA that we actually got that data released. We got more information, and the science is overwhelmingly clear that no amount of PFAS is safe. So this week's regulations are huge and a really big deal. But again, they're only like 6 out of more than 10,000 types of PFAS. So it's a start. It's a really good start, but so much more needs to happen.
And for people that don't know, I mean, PFAS could be found in everything from dental products to dental floss to firefighting foams, children's toys. They're kind of byproducts during the manufacturing of things like Teflon, non-stick cookware and things like that. I covered a story in North Carolina a couple years ago in the Cape Fear River that was dumping PFAS in there, and 500,000 people got their drinking water in the Wilmington, North Carolina area. We mentioned the Ohio River Valley. Everybody knows about Flint and the lead and bacteria, but there's also been PFAS issues in Michigan. I mean, pretty much all over the place. And the relatively scary part is obviously anyone could get cancer. I mean, people could have genetic markers, family history, but I mean, there are areas where cancer has ticked up where they have found, these chemicals at high rates in water. Isn't that correct?
Yeah, they're likely carcinogens. EPA has officially classified as likely carcinogens, but people have lost their parents, lost family members to cancer when their water has been contaminated with PFAS. And it can harm many major systems of the human body, even like the immune system, the reproductive system. So PFAS have widespread health impacts. That's why the EPA estimates that the new regulations will save tens of thousands of lives, even though we're only covering 6 out of thousands, more than thousands of chemicals, that this measure alone will save tens of thousands of lives.
And obviously, I'm a cynical Susie, so we know that water utilities game the system on lead testing, on a whole lot of other testing. Obviously, you're not like scientists or anything like this, but do you anticipate the EPA is going to be doing the testing? Are they going to rely on local water utilities to do the testing? And what kind of oversight would you expect? Because it's one thing to have the regulations. We have regulations for a whole lot of things, but enforcement is often a problem.
It's a big issue. So most states, basically every state but Wyoming and then the Washington, D.C. Have primary enforcement responsibility. So it's kind of up to the states to enforce these new regulations. And they typically like to work with water utilities to bring them along. The testing procedures will be the same. Using the certified labs, the state certified labs for water quality testing. One issue is that the levels of PFAS, the enforceable level for these PFOA, PFOS is pretty low. It's parts per trillion. So a lot of utilities are saying we don't have testing capabilities for that. So having to use other labs for those testing might be an issue. And also many systems haven't completed testing yet. So they call it the unregulated contaminant monitoring rule. A lot of all 6 chemicals were included in that, but it was only a handful of systems that were required to respond. And those tests aren't due until 2026. So about a quarter of them done so far. The rest of the systems we don't have data for. And so the new regulation will require all systems to test for these 6 chemicals within 3 years, which will be huge because right now we do lack a lot of good data. So the scope of the crisis is not known. But as you said, will the data be accurate? Will utilities be forced to comply? And then I think another huge issue is who's going to pick up the tab to update treatment systems so that we can remove PFAS. We strongly believe that polluters have to pay. We shouldn't force people who have been impacted by PFAS, who've lost family members because of these carcinogens, to pick up the tab for these corporate polluters. So a huge thing EPA has not finalized yet is the polluter pay regulations. They have to designate these chemicals as hazardous substances under the Superfund law so that we get more tools to hold these corporate polluters accountable to pay for the cleanup costs. So it's not coming on to ratepayers who are struggling with unaffordable water bills already.
Right, because corporations and industry are already complaining that, this is going to cost overall $1.5 billion in annual costs, and they don't want to pay it. But, people who get cancer and have miscarriages and other things certainly shouldn't have to, shoulder the burden of the human, emotional, and obviously medical costs. I want to ask you an overall question because a lot of people, I think, mistakenly think the EPA and environmental regulation went to hell under Trump. And sure, he did a lot of bad things, but there's been issues with the EPA, particularly the Safe Drinking Water Act, forever. And I just saw it recently. I mean, I was covering a water crisis in coal country, West Virginia, Wyoming County, where we can't prove definitively, but I believe that the coal mining underground breached the aquifer. Residents with well water, which hundreds of residents get their water from wells. We saw black, kind of stringy white particles in their wells. Residents are having nausea, vomiting, diarrhea, headaches. I talked to, healthcare whistleblowers who are afraid to speak out publicly, who are saying they're seeing a huge spike in patients. And I saw green stuff in the water that looked like fungi. Anyway, long story short, when I reached out to the West Virginia Environmental Protection Department, you're just getting the same, boilerplate. Well, we tested for, what we're mandated to test for in the Safe Drinking Water Act, and it all checked out. But meanwhile, the water all over the community stinks of horrid, like rotten eggs times 10, and residents are getting sick. Can you kind of talk about the gaps in the Safe Water Drinking Act? Because there's a whole lot of things that are not mandated to be tested for.
Oh, that's a huge issue. And that's kind of one of the reasons why the new regulations are such a big deal. These are the first new contaminants to be regulated under the Safe Drinking Water Act since Congress passed the amendments to the Safe Drinking Water Act in 1996. So we're talking more than 25 years since we've added a new contaminant. And these chemical companies, other manufacturers, we keep creating new chemicals, releasing it to the environment. I think it's a bigger problem than EPA. It's about our entire regulatory regime in the United States. We don't use the precautionary principle. We don't say, hey, prove this is safe first before you release it to the environment. We don't ensure that things are safe first before we allow, it to be released to the environment. And I think that's kind of the crux of the issue here, especially when we're talking about these lab-made chemicals. These aren't naturally occurring. These chemical manufacturers made them and added it to a variety of products. So these are human-made, lab-made chemicals and toxics for PFAS. And we are still allowing, the EPA is still allowing more and more PFAS to be introduced, right? As we phase out certain PFAS, we find they're toxic, like PFOA, PFOS. The EPA then allows new forms to be created and used to replace them. One issue is Gen X. You mentioned North Carolina. The issue is in North Carolina is often around Gen X, which is a shorter chain PFAS, the newer generation of PFAS. So they phased out PFOS, PFOA, and they replaced it with things like Gen X, these shorter chain compounds. But what we're finding is that they're just as toxic as the older, longer chain PFAS. And they're actually harder to remove from drinking water because they're shorter. They bypass some filters. And the only really effective way to remove these shorter chain compounds is reverse osmosis, the most expensive form of water treatment. So this is a problem with our entire regulatory regime, that we're not making sure that things are safe first before we allow them to be released to environment and exposed to people.
Right. And just for the PFAS in particular, you're expecting that this would start being implemented by 2026, I think you said?
Well, the testing regulations are required to be done in 3 years, so 2027, and then the rule goes into effect in 5 years, so 2029.
Okay.
So it's pretty far off still.
Yeah, gotcha. Thank you for taking the time, Mary Grant. Everybody, check out Food and Water Watch. It's not, the sexy stuff covered on CNN. It's not whatever stupid thing Trump said today, but water is kind of the most important thing, as is food, to your health and longevity in life. So they do great work. Thanks for taking the time.
Thanks for having me.